Our topic is lung transplant journey, adjust, adapt, and overcome. And I know Dave went through our lung
Barb,
transplant.
how are you?
Good morning. I'm just going to introduce you. I know Dave through our lung transplant support program. So Dave Roberts is a former Assistant Deputy Minister of Education and the current C21 Canadian Ambassador. C21 Canada is a national not-for-profit organization that promotes and creates 21st century schools and systems. As an innovator in education, he has addressed audiences all around the world. Dave had his transplant in 2018. He has been married to his wife, Susan, for 50 years, has 2 children and 4 grandchildren. And I think I might have cut that out, but I don't know. He certainly gives a lot of credit to his wife, Susan, for I think being the leader of the pack, so to speak. So please welcome Dave.
Thanks, Barb. How are you? And hello to everybody. Can you hear me okay?
I can hear you, so
Yes.
hopefully, yeah.
Yes.
Okay. And thanks to the previous speakers, I enjoyed listening to Maria and Sonia, and Bernadine and Melanie, and their very informed presentations and the very great technical nature of their presentation. I assure you my slides won't be as good and my technical information will be far less, but hopefully it'll be understandable. So you're going to get a bit of a patient's perspective, if you will, on the journey through a lung transplant. So the first slide you're seeing there is basically a slide of what it was like about 11 or 12 years ago when a family of 10, it's a son, a daughter, 4 grandchildren. Actually, in the picture, there's only 3, the 4th one came along. And my wife and I were very involved in doing Ironman races all over the world, whether it was in Portugal, the United States, South America, wherever it was. We were involved as a very athletic family. 11 years ago, I retired from the Department of Education as Assistant Deputy Minister and had an inordinate amount of time on my hands to spend great amount of time with my grandchildren and my wife, and running various Ironman races as well. And then about, I guess, 12 years ago now, on October 15th, 2013, actually 10 years ago, I was diagnosed with idiopathic pulmonary fibrosis, which was a shock to my system and a shock to everybody's system around me, quite frankly. Actually, on a laughable note, my friends for years had always been saying to quit running, biking, and swimming because I was going to wear my lungs out. I always thought it was a joke. Little did I realize it was going to come to pass someday. So on about October of 2012, I was identified through a respirologist in the city of Fredericton that I'd gone through a variety of x-rays and a variety of tests, and when told that I had something called idiopathic pulmonary fibrosis, or IPF, a word that I could barely pronounce and still to this day have trouble with it. And all that was prescribed for me at the time was basically that I was to go home, sort of enjoy my life. I had something in the range of 4 to 6 years to live, typically, with a person with IPF, and no other options really in terms of what to do next. Who do I talk to? What about diet? I was told to go home, eat, drink, do whatever I'd like to do, and just be ready that life will come to an end in 4 to 6 years. So it wasn't a very, very pleasant meeting, if you will, or an optimistic outlook as to what the future, what in fact might look like. So the myth was that was pretty poor information. The reality was, at that point in time, you realized if you were going to do anything about the situation you were in, you're going to have to take the bull by the horns and see what is possible in terms of going forward. So we went through 3 stages. The adapt stage was a stage where someone gave me this information. It was a little like Survivor. You think, wow, is this what I'm facing? Then you have to figure out a game plan to go with it, which is the adjustment part. So following the diagnosis, there was a series of medications that were recommended as well that would never cure, but would obviously slow down the onset of and the progression of IPF. you had a responsibility to yourself and others around you that you were going to try to identify supports that might be in your world that might help you deal with what you were going through and what you might be going through. And those are people like not unlike Barb and Ann and Melanie and Dusty and the people at the MD Lung Association, but others across Canada who had been involved in IPF related circumstances and situations. But never in that first 3 years did the prospect or even possibility of a transplant even come to my attention, or was it even ever brought to my attention, quite frankly. So after 3 years of really trying your best to deal with this disease and having it become progressively slightly worse on about every 3 months, you notice a certain downgrade. We went to Toronto to get on the caseload of a respirologist who was on the pre-transplant team. His name was Dr. Shane Shapira. And basically he gave us the talk, the transplant talk. Now, by the way, all during this journey, this is not intended to be a sad, depressing journey. Quite frankly, there were more laughable moments along this journey than there are sad moments along this journey. But I remember when I was sitting in his office in the Toronto General Hospital, and he was talking about the possibility of a transplant, which was foreign to me because I hadn't even explored it. And he was telling me all sorts of things about the transplant, the process, and going through it, yada, yada, yada. And my son was there with me. And I'm a tall, slight person anyway. But he was telling me how when you go through this transplant, there's a very real possibility following the transplant that you'll lose your hair and you gain an enormous amount of weight. Well, that in itself, and I'll tell you down the road, became a bit of a fallacy, in fact. So when we were informed about the possibility of this lung transplant journey, a number of things had to be done. Basically, you had to get a referral from your respirologist in whatever province you're in, send it on to Toronto to the transplant team. They looked at it. Following that, you had to go through things like a pulmonary function test, a chest x-rays, CAT scans, ventilation perfusion scan, heart test, electrocardiogram, echocardiogram, all those types of things, blood tests, virus testing, 6-minute walk test. And by the time you go through all these different steps, including going through and trying to identify if you were to have a transplant, who would in fact be your insurer for some of the medications that are going to be you'll be responsible for following the transplant. And then you go through some, I would characterize as being a bit of a talent show. You go and you meet with different members of the Toronto transplant team. So you meet with the respirologist. This is a pre-transplant respirologist and a post-transplant respirologist. You meet with a nurse practitioner, social worker, assessment coordinator, anesthesiologist, cardiologist, dietitian, physiotherapist, medical reimbursement specialist, very important, psychiatrist, and a psychiatric nurse technician usually. And you'll also have all sorts of blood tests done to see if your body's immune system will be able to handle the new lungs if you were to go through the transplant process. So the reality for me was that I guess I succeeded in getting through this battery of tests, and I was approved to be an eligible candidate. That doesn't mean I'm on the transplant list, but it ensured that I was an eligible candidate for someday, as the disease progressed, for being on their transplant list. And being on the transplant list, it's not this huge list that you would think. Sure, there could be a few thousand people across Canada who would want a transplant, particularly in a lung situation. However, when you go through this funnel of tests and a battery of tests and you get down to the final analysis, there are, at this point in time, as of today, as a matter of fact, I think there are 40 females and 31 males on the lung transplant list going forward, awaiting lung transplant in Toronto. So these people are on the actual list. I'm now on the pre-list, if you will, waiting for the disease to progress to a point where in the lung transplants, it's really the worst go first. So waiting for the disease to progress to a point where they would say, now it's time to move to Toronto and we're going to see if we can get you on the transplant list, which really happened about, to be honest with you, it was about 2,110 days ago. And one thing you can control prior to the transplant. The only thing you're really in control of prior to the transplant, you're going to control what you eat, how you diet, how you exercise, and your attitude or how resilient you are. The preparation for the transplant is arduous. They don't want you to go into an operation with the prognosis or possibility of terminating yourself on the operating table or not being able to survive the recuperation period of 90 days following it. So it's incredibly important that while you're preparing to be on this transplant list, you do the exercises you need, eat the way you need to eat, do the exercises you need to exercise, surround yourself with the most incredibly positive people you can surround yourself with, and be positive about the outlook for the future. So finally, I arrived from, I'd been in Arizona for about a month. I finally arrived from Arizona via Air Canada, and immediately, only because my IPF had gone into an acute stage. So I arrived in Toronto, went immediately from the Toronto airport to the emergency, an outpatient's part of Toronto General Hospital, and within 24 hours, I was admitted to the hospital, and 9 days later, I was officially part of the lung transplant list. All that meant at that point in time is that you're now officially part of the list, and they're now starting to look for lungs to fit you of your blood type. So at that point in time, you have the opportunity, you have to take the opportunity to find yourself a place to live in Toronto, which we did, a lovely 500 square foot apartment that cost $1 gazillion a year, a month. That was within 15 minutes of the actual hospital. So you're in a wait period now. Coincidentally, at the time, because of the acute nature of what I was going through, my waiting period was far less than others. Others had been up there for a year plus. A typical waiting period is somewhere in the range of 5 to 9 months. I was there for 18 days when the first call came for the transplant. And that's a very scary proposition, quite honestly. You have moved to a strange city from downtown Fredericton, and all of a sudden your phone rings to let you know that they have lungs for you. And by the way, you're given a hint that there's something going on. Even though you're living 15 minutes away, you've heard helicopters during the day fly overhead. And typically, those are helicopters coming and going on a daily basis to the Toronto General Hospital roof. So you get the first call in. There's lungs here for you, David. Take 20 minutes to be here at the hospital, and then you go through a whole battery of initial, just small testing, but more or less getting you ready for an operation. So they end up marking up your entire body, getting ready for the surgical procedure. They start you with an overload of anti-rejection drugs, and you wait, and you wait, and you wait. And then 6 or 8 hours later, they come down and they say, "Oh, we're sorry, but these lungs didn't fit for a variety of aren't fit for you and wouldn't fit you for a variety of reasons. Everything from they were too damaged to it was wrong blood type, they were the wrong size, something might have happened." So we did this on 2 separate occasions. Now, some people might characterize that as being somewhat harrowing. I didn't find it at all harrowing. I found it a good preparation for the real thing, if you will. So by the third try, you go into the hospital, and this night is going to be the real, you have a sense it's going to be the real night. The person who harvested the lungs from either Halifax or St. John, we're not sure where, came down to see me. His hands were cold. He touched me on the shoulder. He was a doctor from Japan, and he assured me that these were going to be the right set at the right time for me. And it's really interesting because in the hospital at that point in time, during that period of time, the hospital is all abuzz. This is like 6 o'clock in the morning. It's all abuzz because the helicopters landed. They don't land with just Dave Roberts' lungs. They land with a variety of organs that are going to be transplanted. So the whole floor is mobilized to the extent that of something you've not seen before, nor have you experienced. So they then roll you down to the operating room, and so it's a little like being in the United Nations. Around your table are 11 different people assisting in the surgery, and they were from everywhere from India, New Zealand, Ireland, Australia, United States, Canada, Persia, Pakistan, because the Toronto General Hospital is also a teaching hospital. But what was the most comforting piece of getting into the surgical room was the fact that in there was
Hi, Dave. Sorry to
Yes.
interrupt. 5 minutes.
Okay, was a Dr. Kashadjing who's done more lung transplant operations than anybody in the history of lung transplants. So that was very comforting. So to make a long story short, lung transplant took place. They did a biopsies and testing on the old lungs. Found out there was 18 days left. So it was cutting it a little bit short. The reality is sometimes people say after the operation the next day, which is really about 24 hours later when you're somewhat cognizant of the world around you again, people say, well, you must feel like a new person. You see these ads on YouTube where the person wakes up and takes that first breath. Trust me, it's not like that at all. You wake up, you feel like crap. You've got 7 tubes poking out of your body, but you're also excessively grateful to be alive. But what you have ahead of you is you have 90 days to recuperate. They expect you after a lung transplant operation to spend 90 days in Toronto, going through a variety of tests on a weekly basis, going through exercise on a daily basis, but also ensuring that your medications, which are critical, are adjusted to where they keep you on that above living standard to the extent that you're suppressing your immune system. So you essentially have about a 2 or 3% of what you originally had immune system, and you're suppressing it with the anti-rejection drugs because nothing your body wants more to do than to reject those new massive lungs they put into your body. So I had the great benefit throughout this entire process of having 10 people on my team, myself, my wife, 2 children, 4 grandchildren, and their spouses. And it was incredibly wonderful to see a group of people pull together the way they pulled, because I could not have surrounded myself with more incredible people. Some of the challenges going forward are, this is over 5.5 years for me now. Some of the challenges going forward were just basically, how do I find me again? I kind of liked the old me. That sort of suited me fine. I played hockey, I played pickleball. My wife and I were doing a lot of traveling. But how do I find that old person that laughed at life and enjoyed life? And that's always been, I can't even characterize it as a struggle. It's just been a journey of trying to find that. And thanks to the people around me, I find that. And I've had the opportunity as well to give a little back. I created a lung transplant mentor system whereby I can deal with 75 other people across Canada who have gone through what I've gone through. And we just have incredibly healthy conversations about what they're doing, what I'm doing, what we can do together, what's helpful, what's not helpful, who we should talk to, what we need to address going forward. So it's been an incredible journey, but all the way along, I've had these 10 people, but I've had one in particular. And on this last slide you're seeing right now, I've characterized her as she, only because if I was going to play music, I'd play the music from I can't even think of the movie now with the song "She" in it. But she has been incredibly important to me. And as a matter of fact, this December 29th, we'll celebrate our 50th anniversary. I'm not sure she's going to keep me on till then, but there's a hope for sure. So that's basically the journey. The gaps that still exist today is the medications are always problematic on a daily, weekly basis, and making adjustments on an ongoing basis. Medical consistency with the people you refer back to in Toronto, transplant team, they're always in your corner. You have something called Easy Call. In 30 seconds, if I was to make a phone call, they'd get back to me in 30 seconds. And you have your people around you who are in the same situation as you that allow some great group talk, but it's definitely a gap that really has to be orchestrated better than it's currently orchestrated. So that's a journey. There's lots of highs, there's lots of lows, but there's a ton to laugh about as well. I've met the most incredible people on this journey who to this day have now become not only colleagues or warriors, but also friends. And that's been invaluable to me. So there, Barb.
Whew. I can say, take a deep breath. Whew.
Yeah, really. Yeah,
I
yeah.
so
And I can take that.
I know, that's what I mean. I just wanted to mention, I know it looks like there's a question, but it's actually an appreciation. Thank you from someone anonymous. I wanted to mention, of course, the New Brunswick Lung has a lung transplant support program, and we have a great list of everything you need to know to get through this process. And I personally, as you know, talk to people all through the process. I wanted to mention that the the rent is not $1 gazillion. I did advocate about 6 years ago, so Medicare now gives $2,500 towards your rent. It's about $3,000 a month when you relocate there. And yes, and your anti-rejection drugs, you used to have to buy them from your home drugstore and have them FedEx to Toronto. So NB Lung, we advocated for that years ago and made it into third-party billing. Anyway, that's enough about me. So that your story, as you know, and I know you'll take this the right way. It's not unique. It's everything that Dave said is literally what I have heard from 160 patients over the last 14 years. You just living your life and then wham. So you're looking great.
Well, thank you. I'll give you one little anecdote, nothing to do with looking great, by the way. But when you're
Healthy.
when you're pre-transplant, and every day you go to the physio room at the Toronto General Hospital, and you're working out with other pre-transplant and post-transplant patients, and everybody as pre-transplant and post-transplant starts on cyclosporin, and it's a drug that, unbeknownst to a lot of people, enhances hair growth as well. So I happened to be working out pre-transplant with a couple of guys and post-transplant with a couple of guys from Newfoundland who started out with very little hair and gray and white sideburns, but ended up with looking like Elvis with these incredibly dark sideburns coming down their side and a thick head of hair. So I was told when I was first told about the transplant that I'd gain weight and lose hair. You can now see that I did not lose a hair on my head, and instead lost about 30 pounds. So there are some myths out there and realities that have to come to bear. So Barb and crew, thank you for organizing this. And as you guys do things incredibly well, at times on limited budgets, and I appreciate that. But believe it or not, on the side, some of the things information you've passed on have been invaluable to me and others. So thank you.
Well, thank you. And thanks for a great presentation. All right.
Good, Barb. Thank you.
Thank you. Bye. Have a good day.
All right. Yep. Bye.